I'm John Mason. I work for the Deschutes County Environmental Health Division, part of the Health Department, and I'm a registered environmental health specialist. We're out trying to protect the public's health. So I'm a county employee. I work just within Deschutes County, and I have 250 pools that I inspect. About half of them are, about let's say a third of them are seasonal, so they get one inspection a year. But we have lots of indoor pools, spas around here, so those get inspected twice a year. And they're always unannounced inspections. My job is to protect the public's health, and I do that by educating the operators on how they can meet the rules best, explaining chemistry and filtration and some other simple things like that. I prefer to think of myself as an educator, not a cop. I think, my job is probably 90% education, 10% enforcement. At least that's the way I hope it goes anyway. There are some safe swimming techniques that we want to make sure that bathers know about. Three simple ones are: don't swim if you've had diarrhea in the last 2 weeks. The germs that cling on you can get into the pool. Please take a shower, get rid of that stuff so it's in the sewer and not in the pool, so the chlorine has to go after it. And take bathroom breaks frequently. It's pretty important for bathers, for swimmers to be able to take a shower before they get in the water. One of the things that we as the health department are trying to work on is letting people know that chlorine doesn't kill bacteria immediately. Sometimes it takes hours, and depending on the bacteria, days. And if people bring a lot of lotions or sweat, dirt into the pool, well, that's that much more that the chlorine has to go after instead of killing the bacteria. So part of our next 5-10 year plan is making sure that bathers know that they have an input on the water quality they're swimming in.